The heart is like a machine. So any machine work rapidly will damage rapidly. So the beta blocker will decrease the activity of the heart, and that lead to make the heart work longer. The patient with atrial fibrillation and heart failure, this increase the risk of the patient like strokes and death, and also will change my mind to how to manage the patient. The patient with AF and congestive heart failure should receive anticoagulant because of the high risk of stroke and also death. And the management in this patient better to be rhythm control instead of rate control. According to the patient with the renal problem and chronic kidney disease, because the renal index is high, that interfere with the most of the drug I use it for the AF, so I should decrease the dose, especially the anticoagulant. And if the patient is in the end-stage renal failure, I prefer to be rate control instead of rhythm control. Simply, if I have what we called has a bleed score, this is depend on the patient has hypertension, if he's any abnormal renal or liver problem, history of stroke, or if the patient has a previous stroke, or the patient has another drugs use, or there is any bleeding tendency. So if the patient score more than 2, 3 and more, it is preferred to use another way for anticoagulant, like LA appendage closure. If it is less than 2, so I start anticoagulant. Every product in the world should have a quality control. I think that the German product is the quality control. I have a 16 years old female diagnosed as a dilated cardiomyopathy for about 3 years. She's wheelchair and admitted to the hospital with disasters and IV line. And after that, I reassessed the patient and diagnosed as an arrhythmia-induced cardiomyopathy. And after ablation, the patient become well, and now she is get married and have a nice family. Blood pressure, we have diastolic and systolic blood pressure. Usually we have a range for the systolic and diastolic. The systolic blood pressure, the normal range, it is between 100 to 130. Anything above 130 is hypertension. Anything below 100 is hypotension. About the diastole, it is between 60 and 90. So any blood pressure 140 over 90 is a hypertension and should be managed. Is a patient the blood pressure 90 over 60, so a patient is hypotension.
So when it matters most, choose Denk Pharma. For your health and the health of your loved ones. Denk Pharma. Quality for your health. Made in Germany.